Here we go. We are gonna Gua Sha. So look how she's doing it, guys. You have to clear your chest, then your neck, then your face. You go upwards in terms of your body parts.
For all you girls who live up north, you can't shovel snow at an angle like this. You've got to go at a low angle. You've got to move it into your armpits because that's where your lymphatic terminals are. If you're working on yourself, make sure that you secure your skin because you don't want to rip up your chest. When you go up your neck, go up gently. This is what attaches your chest.
She's being very gentle with me. This is not pulling my skin.
No. And what's really important is this transverse stroke. So you're going to pull it over the SEM, that's the muscle that holds up your neck, and you're going to gently anchor the skin down like this. So this is if you were doing it at home and not me. Same thing with your chin. One side at a time, and you want to stay at a 15 to 30 degree angle. Here, we're going to work on Laura right here. This is where she's clenching. This is your masseter.
So if you grind your teeth, that area needs a lot of help.
And then you can, in here, hold the skin, and you always want to move into the lymph. So we have lymphatic ducts here, along the neck, along here in the chest, in the armpits, and also the sides of the face. But lymph doesn't move on its own. Now, exercising helps, so you want to just give like a baby wiggle. Now, under the eyes, always support the skin. So what I have my patients do is you can hold your face like this, very low. You're almost working at like a 0 degree angle.
And she's being so gentle, guys. Do not be aggressive, especially in your eye area.
Yeah, and if you're my age, forget it. You're not gonna get that collagen and elastin back. You can stimulate it. If you have crow's feet, like you're beating eggs with a fork, always move up and then do a lateral stroke out. So up against gravity and out. And then you can work the brow gently, but you're always going to secure it. So I do like doing like a V hold when I work on my own face, where I split my fingers. And then for instance, Laura, because she's Miss Computer, we have to work in here. So you go upward, baby strokes. Remember, you're going to try to keep it an angle, and then out. Very gently. And then if you are using the computer a lot, you want to fan into your forehead. Our muscles to our face are attached into our forehead, but into the hairline. Always going upwards and out.
So if someone wants to tackle a wrinkle, whether it's on their forehead, they're around their mouth, what would they do? Okay. What motion?
So always remember, so we're gonna show people like right here in your chin. So very gently start at the midline, work up. So upward, remember gravity falls, and then you wanna move it out toward the lymph. Now remember, I'm working on you, so you're gonna have a dominant hand, and then you're gonna have a weak hand, so you're gonna have to do like the crossover, like this. So one side isn't gonna be, it's gonna be harder just because of that. For those people who can use both left and right, more power to you. But remember, up, out, at an angle, at an angle. So you can see this is up at an angle and out at an angle.
And you can do this as many times as you want, right? But a minimum of 3, 5, 7.
You can do like 3, 5, 7. It really depends. You know, you can do a general pass. You don't need to work your chest like a lunatic, but you do want to clear the lymph out. You have to be very gentle along your neck. Remember, you also work at a transverse.
Yeah.
So gently move this way across the neck, and you can get into the back and almost move back to like the back of the neck.
Mm-hmm.
There's a lot of muscles here that hold the head up.
Okay.
Okay. Jaw. Forehead up and out, and then you can finish with just a general sweep.
Perfect.
I'm using my hands and not the Gua Sha.
All right, perfect.
Like
Thank
that.
you very much.
You're welcome.